So I did my second video project on cardiovascular health, and some of the things I'm going to be talking about during this presentation are some of the disease processes, some risk factors. There's modifiable risk factors, and there's also non-modifiable risk factors. Some visible signs of cardiac risk, so something that you can visibly see in somebody. Some signs of cardiac emergency, some initial treatments for cardiac emergency, and some preventative measures. So some of the disease processes, there's many processes that go on with cardiovascular health. So cardiovascular disease is not just one single disease. It branches off into many other conditions that can evolve from poor cardiac health. So the first one is coronary artery disease. This is the most common type of heart disease, and it affects both men and women, and it is the leading cause of death for both men and women in the United States. So pretty much this is the most common one, and it occurs when the cholesterol builds up along with other materials. When that all comes together, it creates a plaque, and the cholesterol buildup and the plaque and everything that builds up in your arteries causes the arteries to become narrowed and hardened. So if your arteries are becoming narrow and hardened, it's making it very hard to have proper cardiac output. It can lead to a bunch of other malfunctions with your heart. Then we have peripheral artery disease. So this is damage or a blockage in blood vessels that are distant to your heart, so peripherally, like the peripheral arteries and veins, not just the main ones that are leading into your heart, but the peripheral ones as well. Cerebrovascular disease, so this is like a group of conditions. It affects the blood vessels and the blood supply to the brain. So if any kind of blockage or malformation occurs, it can prevent the brain from getting enough oxygen, and brain damage can occur to that if the brain is not getting the correct amount of oxygen supply that it needs. And then we have hypertensive disease. This is a combination of conditions. So many of these conditions can be caused by this. The ones that I previously talked about, hypertensive disease can also cause. So all of these conditions can be caused by high blood pressure. So if the heart's working with an increased amount of workload, it can have poor output. It can result in many disorders like heart failure. It can cause thickening of the heart muscle, coronary artery disease, and a bunch of the other conditions that I just mentioned. So some medical emergencies that can follow these conditions, angina. It's a type of chest pain, and what causes it is reduced blood flow to the heart. So a lot of people will feel this pain in their chest, and it can feel like a pressure, a tightness, or just a pain just around the chest. You have a heart attack, which is also called a myocardial infarction. This is when the blood flow is completely blocked or partially blocked from the heart. So the heart is not receiving the adequate blood flow that it needs for the output that is required from the body. Then we have a stroke. There's many different kinds of strokes, but the two main ones are ischemic and hemorrhagic. Ischemic, it is damage to the brain, and it's caused by an interruption of blood supply. So if there's an infarct or there's already damage to the brain and the blood supply cannot properly flow where it needs to be, this can cause an ischemic stroke. Hemorrhagic, when the blood begins bleeding out from the artery. So this is like an aneurysm. It's caused by weakened blood vessels. All right, so some of the risk factors, there's non-modifiable, so things that we cannot change, and there's also modifiable risk factors. So for non-modifiable, your age. So a lot of these conditions begin to be present between the ages of 45 and 55. Your gender, in the United States, both male and female are affected by heart conditions. Genetics, if you have a family history of heart disease, this is something you also cannot change. Modifiable, if you have high cholesterol, it's something that you can get under control with proper medication and diet restrictions. Hypertension, another one. For example, a diet for hypertension is the DASH diet. A lot of people have used to decrease their high blood pressure, and as well as getting it controlled with medications temporarily until it can be maintained at a normal 120, around 120/80, as close as we can get it. Tobacco use, this is actually one of the number one things that people can change for preventing heart disease. So if you use tobacco on a daily basis, there's been many people that have tried to quit tobacco use and has improved their cardiovascular health tremendously just by stopping their tobacco use, not even incorporating these other things. This is one of the main things that people can do because tobacco use really has an effect on our cardiovascular system. Diabetes. If you control your diabetes, maintain it, don't let it get too out of hand, this is something you can do to prevent these conditions. Obesity. So along with obesity can cause hypertension, high cholesterol. So those are things that we need to get under control. So by losing a little bit of weight, you can decrease your blood pressure, you can decrease your cholesterol, and that'll overall improve your cardiac state. If you aren't really physically active, just going on a walk can, once a day, a 30-minute walk can tremendously improve your cardiac health, even if it's not anything crazy. Physical activity is something that a lot of people, before medications, most physicians will recommend diet change and physical activity, and this helps a lot of people in the long run. Another thing is mental stress and depression. If you're not handling your stress, this can cause increased heart rate, increased blood pressure, which can, again, lead to many of these heart conditions. So some of the visible signs for cardiac risk, so something that you can see in somebody physically, increased waist circumference, so that around your belly area. So I believe for women it's 35 inches and for men it's 45. When you begin to see a buildup of the fattiness around your stomach area, that puts you at risk for cardiovascular event. Some cold extremities, so like your hand, your feet, and your nose peripherally. Some people who constantly have these hands, feet, and nose, they're constantly cold. Peripherally, like peripheral vascular disease, something like that. Hair loss on the lower legs. So for an example, peripheral artery disease can cause hair loss on the lower legs. Shortness of breath with mild exertion. If you're just walking up a flight of stairs and you're physically out of breath, this is a sign that you're at cardiac risk. Even if you're just walking and you're noticing that you're completely out of breath by doing something that you're usually not out of breath doing, this is a sign of your cardiac state is at risk. And then lastly, some brain fog and mental confusion. A lot of people will confuse this with, oh, I'm just getting old, I keep forgetting everything, but this could also have to do with your cardiac risk, and less oxygen getting to where it needs to be can cause some mental confusion with that as well. So some signs of cardiac emergency, the main one, like I said before, is the chest pressure, the tightness, the pressure, the pain. A lot of people say that it just feels like there's an elephant sitting on their chest. A lot of people also get shoulder, neck, and jaw discomfort. So when someone's having a heart attack, a lot of times they'll have the pain around their jaw area, their neck, and radiating down their shoulders, as well as the pain and radiating down the left arm. Sudden profound weakness. I actually just watched a video of someone on a TED Talk explaining how when he had a heart attack, it felt like somebody pulled the plug. It felt like all of a sudden he had no strength. He couldn't even get up and walk, like even just breathing and moving just an inch made it feel like he was running a marathon. Like he had no strength to do anything, and it just felt like somebody pulled the plug. And then a lot of people will get nausea, so gastric discomfort. So along with that, a lot of people will just think they're having acid reflux, when in reality it's not the acid reflux, it's heart related. Sweating, and this isn't just normal like sweating a little bit, this is like drenching sweat. Diaphoresis that is comes out of nowhere, you're not doing anything, complete drenching sweat. And then if this gets really bad, it can cause loss of consciousness depending on the blockage that has occurred or what is going on with your heart. So if you're with somebody or this happens to you, it's important to know what to do initially. So first you want to call 911 or get help. If you're in a place that has an AED, you should always run and get the AED just in case. This is if the person is unconscious and no pulse is detected. You don't want to use an AED if the person is conscious. And then if you're this person and you want to chew 2 aspirins. So chewing 2 aspirins will, you don't want to just swallow them, you want to chew them, you want to get them into your system as fast as possible. This will help slow down the process, alleviate it, and until you're able to get until the ambulance arrives, or till you get to the hospital. This is really important. It can save your life it's a life or death situation. And then if there's no signs of life, you want to begin chest compressions, obviously, if you're with a person this is happening to. So some ways that we can prevent this is, like I said before, the tobacco use, so smoking cessation. This is one of the number one things that can cause cardiovascular disturbances. So if you quit smoking altogether, this can really decrease your risk for a cardiac event. So you can improve your diet. So for this, there's a lot of other opinions, but